have like literally billions of cells always dying, and then you make new ones. But those old ones, they need to get out. If they stay in you, that's not good. That's toxicity. The lymphatic system, that's its primary job, right? Is to keep bad stuff from killing you. And when it gets in, it has to get rid of it. So for me, when he did all these assessments, I was blown away because these areas were excruciatingly painful, and I never even knew that they were painful. And here's the catch. Even if I did know they were painful, I wouldn't be thinking that they're painful because my lymph system was a problem. You follow?
Yes.
I would be saying, oh, well, my sternocleidomastoid or my tecmiter is sore, or it's an irritated nerve, right? And where they pressed first was a place that I have everybody check, and you can do it now if you're watching or listening, but the largest lymph node in your neck, and a node is kind of like a big giant kidney, like a filter system, right? And they gather together in clumps. And the largest one is in the neck, is right at the top of the neck, behind the angle of the jaw, right in front, right below your ear. There's a little space as high as you can get. So you feel on the right with a couple of fingers, and then you feel on the left with a couple of fingers on both sides, and you see, does it feel puppy? Does it feel tender? Does it feel sore or painful? And if it doesn't, that's awesome. That's what you want. Right. Mine were horrific. Mine were painful, and they were very swollen because they were congested, obstructed, stagnated. And see, I'm a chiropractor. So when you push there, I would originally say that's the first and second vertebra in your neck, C1, C2.
Yeah.
And I would adjust to manipulate that, and then bing, bang, boom, I'm done. But the reframe for me was that is painful because the lymphatics were congested and obstructed, and then there was a lot of inflammation in there that was irritating the nerves and irritating the muscle and restricting some blood flow in my neck and into my brain, which might explain why my brain fog was so bad, because I had toxicity in the brain. We'll get into it later, why this matters for the brain and how the brain functions and how somebody moves and how they interpret pain. And so he just made his way around all the lymph nodes in my body, and I hated this dude by the end of it because it sucked, man. Like I told this guy, I said, you have fingers of Satan, man. You're awful. And what you'll find is that these nodes gather around big primary joints of your body that need to move a lot, because the lymphatic system, it functions two primary ways through movement. So the more you move of yourself, the more you move the lymphatics. So movement is a great thing. And the other way is through breathing, particularly breathing through the diaphragm, which many of your listeners might know what it is, that the primary muscle everybody uses when you breathe in and out. That changes pressure inside your body, but in particular your abdomen, and then that pumps the fluid. So that gets those areas moving, and it keeps the fluid from being stagnant that way, right? And nature's pretty smart, because she put all these lymph nodes, these clusters. You have about 600 to 700 lymph nodes in your body, depending on the resources that you look at, and they clump together, and they're gathered around primary joints. I showed you one at the top neck. So most of the motion in your head and the neck should happen right at the top. Right there is where most of it happens. And the other one is at the bottom of the neck at the collarbone. That's where all the lymph ends up draining to this region back to your heart, which we'll cover in a little bit when we talk about the cardiovascular system. But the other cluster around your shoulder joints, right? Because you're supposed to move these arms like a lot.
Yeah, right? Yeah.
Reach overhead, go backwards, things like that. Not just punch forward and round and then using your thumb, right? Then the other ones are in your hips, in your groin. So they're designed for your hip to go into extension and rotation and all these different moves. And the other one is behind your knees, because you're supposed to walk. Yeah. You're supposed to move. Yeah, and the other one is right in your abdomen, right in the center of your abdomen, that fixed, what we call your quote-unquote core. And that's supposed to move a lot, because you're supposed to twist and rotate when you move. right?
Mm-hmm. Yep.
And most humans don't move. They sit too much. And when they sit, the knees are always in flexion. Mm-hmm. The hips are always flexed. The abdomen is crunched down. The shoulders are rounded forward. And the head is locked in looking at a bone. And all those joints don't move. Mm-hmm. And then they don't breathe through the diaphragm. No. And they're breathing through their shoulders or their neck, or they're probably holding their breath and not breathing at all. So they don't do either one of those, and the fluid becomes stagnant. And here's the fun part, because I have people in the fitness world, and that's what they do. Like they say, Doc, shouldn't my lymph be really, really good? Because movement's my thing, man. That's what I do all day. And then I know about 500 different ways to breathe through the diaphragm, because I've been to like 500 different breathing courses, right? And then, but that's what I was doing, guys. I was doing the same thing. Yeah, I know movement and I know breathing, but my lymph was still a mess. And the question is why? Because what happens is, through so many years of neglect, or having to deal with so many toxins that are coming at it from the outside world all the time. Not to mention that the toxins you have that you knowingly stick down your throat, mm-hmm. which is the food that you eat, or the toxic thoughts that you have, the stress that you have, the tension and the tightness that you have, and stress, it becomes so overloaded that movement and breathing is no longer enough. You have to physically go in there and manually release the blockages. And I compare it to, if lymph is mostly water, so think about water coming down a stream and then it hits a block of rocks. Mm-hmm. It's not going to flow until you move the damn rocks, right? And that's exactly what we teach people to do. I'll teach you the big 6 later, which just means I just told you the 6 places that lymph needs to move the most. And if you can just move those places before you actually physically move and before you breathe, you'll notice a huge difference on that. And then this is where people usually ask me, why does the lymph get so backed up? Because we're living in a world that is so toxic that the human body was not designed to have to deal with. It's just overloaded. And then nobody ever told you about it, or even if they did, you don't know what to do about it when you learn about it, which is why I'm here. Because my story was this: when I started to work this system, or just when they assessed me, because when you assess lymph, this is the first treatment, they released a lot of toxins in my body, and I'll say I felt like I got run over by a truck and then dropped out of an airplane without a parachute. I was like, oh my God, this sucks. But I was going through a detoxification and getting rid of all this bad stuff. But the next day when I woke up, I was like, maybe I'm nuts, man, but I think I feel like 30% better. Like I felt more energy. My brain was starting to wire and fire a little bit better. And I'm like, there's got to be something to this, man. And then from that point on, I was a man possessed. And I just was relentless. And I kid you not, within 1 month of doing the lymphatics and then tweaking a few things that I learned that I teach people, I lost, because I was very overweight, puffy, and swollen from body fat and edema that my body laid down because I was sick. I lost 30 pounds of inflammation and fluid and waste and body fat in 1 month without changing anything in my training routine at all. It was just clearing the lymph and getting my system to not be so toxic. And then most people say, 30 pounds? I'm in, man. Whatever you tell me to do, I'll clear the lymph. Plus I just felt better. I started to look younger. My energy came back. My brain came back. I turned into a different human being. And I thought to myself, why in the hell doesn't everybody know about this stuff? But when I looked into it and I started to try to investigate things, there's not a lot out there. There's more now than ever before, which is nice to see because medicine is kind of coming around. But what they did see was hard to find. But what really got me is that it was presented in such a complicated way and a very overwhelming and intimidating way that most people didn't even know. They're like, just forget it, right? I mean, you know better than anybody else that if you make something too complicated like that, people are just going to say, yeah, it's nice, man, but I'm not doing it, right?
Yep. Yep.
And the body shuts down. And here's the frustrating part. This is what really upset me. In all of my years when I was sick, not a single medical professional that I was seeing mentioned the word limp, right? Not a single one.
Yeah.
And then I thought to myself too, I said, I'm in this profession for 23 years. I didn't even know about the damn thing, right? So it's almost like I couldn't fault them because I didn't even know about it at that time. So my mission now is to teach everybody I can about it. You can tell I love it because I'm still answering your first question. But and here's the biggest takeaway for me. Like all of those areas, it's kind of covering what I said before, but it's really important for people that are listening that are in fitness or healthcare, because it's like, why should I care about limp? By the end of me talking today, all those areas where I'm telling you about, people have musculoskeletal pain all the time. Sore joints, sore muscles, and we're using all of these therapies, foam rolls and guns and creams and ointments, and they're good, right? But they're designed to do what? Take away pain and heal tissue. So I was pressing in all those regions, but not thinking of the lymphatics and what role they're playing. I was just focusing on fascia, ligaments, joints, nerves, lymph. But why do I need to know that? Right? And then here's the reason you need to know. And we'll get into it more, but I'm going to cut right to it. When you're sick or when you're injured, you need to heal. How do you heal? You have cells that are damaged that need to regenerate themselves, but you have to make new ones as well. So chronic pain and chronic disease occurs when you lose the ability to make new cells that work. Think about that for a moment. Because if you could make new cells that work, you wouldn't freaking be sick, because make new cells.
Yeah.
Zippity doo dah, I'm great. So that's recovery, that's regeneration. Then I thought to myself, if that's the case, what do you need to make a new cell that works? That's logical, right? Mm-hmm. And it's really comes down to two fundamental concepts. In order to have a cell that works, it needs nutrients. Agreed? Mm-hmm. And it needs nutrients, and you get that from the stuff that you eat that gives you your energy, right? And it needs oxygen. That's kind of important. So there's that breathing thing again. So it needs nutrients. And then when a cell gets nutrients and gets oxygen, it goes through different metabolic chemical reactions, energy cycles. Some of you may remember the Krebs cycle that you had to go through for your cert or whatever. Right. But that creates metabolic waste, cellular waste. Then you have cell waste, and the cell says, hey, and I got all this waste, I got to get rid of it. So it gets rid of the waste. But if you can't get rid of the waste, it stays inside of you, and then you start to decay. Here's the important part, even when you take in nutrients, because nutrients can't get in if waste can't get out. So the lymphatic system's job is to filter that, right? So that's why I use the body aquarium as my analogy, because people can envision this fish tank aquarium, and inside the tank you've got a lot of water, and the water, if it's beautiful and clear and it has a really nice filter, what's the filter? The filter's the lymph for your body, right? And that fluid in the tank, that's the fluid in you that your cells with. So I want you to think of your cells as the fish in that tank. If the water in the tank is great and you're taking care of, the fish can thrive as long as you feed them, right? Mm-hmm. But what happens if that filter system starts to go? Then the water in the tank turns green, and you get fungus, and you get bacteria and algae, and it gets all slimy and stuff like that, and the fish start to get growths on them, because the fish are pooping too, right? Just like yourselves. And have you ever looked in a fish tank where the water was starting to go, and you check out a fish and their mouth, they're going like this? Yeah. Why are they doing that? Because they can't breathe, because they can't get oxygen. Your cells do the same thing, man. They can't get the oxygen. So then what happens to them? They slowly die. They slowly perish. And it doesn't matter if you keep feeding the fish. If you keep feeding the fish and putting food in, it's more toxic, right? Mm-hmm. So I ask people, say, if you want to save that fish and you want to get that tank looking good, what would you focus on? Filter, right? Filter. But we don't do that in medicine. In medicine, we do the same thing. We just replace the damn fish, right? Or we take the water out of the tank, clean the tank, put the water back in, put new fish in, but don't touch the filter, and then 2 weeks later you got the same damn problem again. So that was the answer I was looking for of why does stuff keep coming back? Why does stuff keep coming back? There's got to be something in relationship to the environment. And when you look at epigenetics, which says that, you know, it's the environment that sets the tone for your health. You cannot get well in the same environment you became ill with that. So in my world, the first thing I do before I see anybody is lymph work. Lymph work. I know it went on for like 30 minutes, but that's how much I love this stuff. And hopefully you're already seeing a big picture of, holy cow, that's kind of an important system.
We had seen your shift from just following you for a long time of how you've transitioned, and so that was interesting. And the story you just gave about the fish tank analogy, Lenny Parasino and I had talked about that, and Lenny had said the same thing. He's like, we have to change our perspective on how we're viewing how we treat our clients and the patients. And so I was like, oh, interesting. Because he said, he goes, if a fish tank if you see fish dying, you automatically know what to do, but we're doing the opposite in the clinical world. And so I was like, oh, very true. So it was a really eye-opening conversation I had with him. And same thing watching you over the years, how you've gravitated and changed. So that's why we said, you know, together we're like, this is something that people need to hear about. So yeah, thank you very much.
You're very welcome. And I tried to. So here's the thing: when you start to talk about lymphatic systems to people, sometimes they're like, I don't even know what the hell you're talking about. Like, you know, lymph what? Like, and why should I care? Well, first of all, if you get sick enough, you usually open your mind to possibilities. But when I tried to learn how to become a better communicator, professionally and personally, something really stuck with me that said, and you probably know this, if you want to try to teach people a concept that they've never heard before, you tie it to a concept they already know. So most people know about a fish tank. Mm-hmm. So when I explain the fish tank, then you go, okay, I got lymph. I understand. And that's exactly what it is. Because it's that easy. The system, in my opinion, is the most important system in the body for survival, but it's also the most neglected system that people are not looking at. And then once you learn how to take care of it, it's very simple to do. And then here's the thing, everybody's always working their lymph. They're just doing it by accident because everybody's always moving and everybody's breathing in some way, shape, or form. But, you know, once you have a structured system of, well, I give a little bit